Hey everybody, welcome to tonight's presentation on the impacts of the gut microbiome and gut health. It's nice to see you all. If you can try to find the chat button, let me know where you are from. I would love to hear where you guys are tuning in from. Make sure that you know where the chat is because we are going to be doing a live Q&A at the end of the presentation. So if you have any questions, if you want to answer them or ask them throughout the presentation as we go, I'll try to get to them. If it's specific, I'll probably leave it to the end, but know that I'm not purposely ignoring you. Sometimes it's just hard to look at the slides and the comments at the same time. In addition, if you can hear me, let me know you can hear me. I see some comments, individuals from Alberta, Quebec, Ontario, so that's fantastic. Many individuals from Canada, which is great. So I can see the chat, you obviously can see the chat, and I'm assuming because you posted where you're from, you can also hear what I'm saying. So I'm going to go ahead and turn my video off so we can have a full view of the slides, and then I will pop back on at the end of the presentation. So tonight we're going to be talking about the impacts of the gut microbiome on thyroid health. Let me know in the comments, have you had suspicions that perhaps there's a thyroid related concern for you? Have you been diagnosed with a thyroid condition? Maybe say suspect or diagnose. What we're really looking at today to look at the gut microbiome, how it relates to thyroid health, because many patients that come to me suspect that they have thyroid related concerns or they've been diagnosed and perhaps they've been put on a medication, but they're just not feeling that all of their symptoms have been gone away. And we're also going to have a look at one of the ways that we can improve the digestive health to have better thyroid function in general. So for those of you who don't know me, my name is Dr. Breanne Kallonen. I am a licensed naturopathic and functional medicine doctor. I'm the creator of the Metabolic Reset program. This is a program designed for individuals to get to the root cause of resistant weight loss, typically designed for individuals who have at least 20 pounds to lose. I am the author of the best-selling book called Wild and Free. This is available on Amazon, and I believe in addressing the root cause of health-related concerns. And my primary focus is really looking at how can we pair what the literature has to say, what the science has to say, and give patients the best of both worlds. So what is the evidence to support the use of supplemental options? So what does the literature say in terms of the benefits, the risks, the alternatives, and we pair that with the options in terms of pharmaceuticals as well. And I truly believe that when everybody's empowered with the appropriate information, they can make the best informed choice for their health. So one of the disclaimers, of course, for tonight's video is this is not a substitute for professional health care advice. This is not used to diagnose or treat. This is for educational purposes only, of course. Now, what are some of the statistics of thyroid disease? We do know that more than 12% of the US population will develop a thyroid condition during their lifetime. Women are 5 to 8 times more likely to have a thyroid disease. And the problem with this is men, yes, they're also affected. And because we are using the stereotype that thyroid-related conditions mostly impact women, what I see for the males in my practice is unfortunately they are not properly tested for it and the diagnosis often takes longer. So this is a very prevalent concern and it's something that we definitely need to be screening for each and every year. It is an estimated that 20 million Americans have some form of thyroid disease. And the main concerning statistic that I came across is up to 60% of individuals with a thyroid disease are unaware that they even have the condition. So that's quite significant. We definitely have a ways to go in terms of how we properly test and diagnose. And I think we have a huge opportunity to improve the time to diagnosis when we're looking at thyroid related concerns. Symptoms of thyroid disease include fatigue, brain fog, hair loss. You can see dry skin and acne. You can see changes to your weight. We look in terms of symptoms of hypo or low thyroid function and hyperthyroid function, but we have to remember that each and every individual is unique and not everybody is going to present the same way. For instance, if your thyroid function's high and you have hyperthyroidism, classically we would see weight loss. When your thyroid's low or you have hypothyroidism, classically we would see weight gain, but that is not a one-size-fits-all approach. I've definitely seen both in my practice. Mood changes, anxiety, depression, OCD, changes to body temperature, so either feeling hot or cold, bloating, heartburn, constipation, diarrhea, as well as infertility, irregular menstrual cycles. These are all different classical signs and symptoms of a thyroid-related concern. Just a quick overview in terms of how the thyroid gland works and how we actually produce thyroid hormones. I do have a previous thyroid presentation that goes into more focus on this. This presentation tonight is really focused on gut health and thyroid. If you want to learn more about the thyroid, definitely check out that previous webinar. So what we have here in this photo, at the very top, you see the pituitary gland. This is a gland inside the brain. And the pituitary secretes something called TSH, or thyroid stimulating hormone. This tells the thyroid, hey, produce thyroid hormone. And the example I often use with individuals is it can be counterintuitive because if the TSH is really high, then you have low thyroid function. So it means that the brain is really having to scream at the thyroid gland, wake up, produce thyroid hormone. It's not listening, and it's not producing the T4 and the T3. What should happen is the pituitary sends the signal, TSH, in the optimal level to the thyroid, please make thyroid hormone. From there, your thyroid hormone will produce primarily T4. This is inactive thyroid hormone. It produces some T3, but the vast majority of T3 that you get is from the conversion of T4 to T3. A big area where that conversion happens is in the liver as well as through the support of the gut microbiome. So that's why we're looking at the gut health. It's really important for the conversion of T4 to T3 to have a good digestive system. Once your thyroid produces T4 and T3, this should send a negative signal, negative feedback back to the brain, like your thermostat in your home, to shut down the production of TSH. It says we're all good. In a healthy thyroid, this is a nice thermostat. It stays at the appropriate rate. One of the things that we really have to look at when we're addressing the thyroid in general is doing comprehensive testing. So what I see often in conventional medicine is only the TSH is run. So we're only taking an assessment of how the brain is communicating to the thyroid gland. In my opinion, that's not enough. I want to know how much T4 the body's producing, how much is being converted to T3, as well as the TSH. All of these in combination are important. There also is another thyroid hormone called reverse T3. Reverse T3 will directly compete with your active thyroid hormone T3. So we don't want too much of this reverse T3 either. This is where the comprehensive testing comes into play. It is very easy to access comprehensive testing, especially in the United States. And if your doctor won't run it, you're looking at approximately $50 to $60 to have this full comprehensive testing. The other two markers that I have listed are thyroid antibodies, anti-TPO antibody, anti-TG antibody. These antibodies are produced by the immune system, and they indicate that your immune system is mounting an attack on the thyroid gland. This is very important information because we need to know if your thyroid-related concern is due to an autoimmune condition, or is it an issue with your immune system. If this is the case, there are a variety of different treatment options that we're going to discuss. Now, when those thyroid antibodies are elevated, they can be elevated to up to 10 years prior to the TSH becoming out of range. Now, what this means is, unfortunately, individuals are going through life being told that their low energy is normal and that weight gain is just a consequence of aging, and you're probably just overwhelmed, or maybe you're depressed, or maybe here, it's all these different options that are offered to patients instead of doing the comprehensive testing. So it's really important. I hope I've drilled that home, that comprehensive testing is key. The other thing to keep in mind with the reference ranges of labs are very broad. Some labs are anywhere from 0.4 to 4 or 5 for the TSH. I find individuals feel best when their TSH is around 2. And if we look at women who are of age, of childbearing age, fertility clinics and a lot of the research on fertility shows that the TSH should be less than 2. So I just go based off of that. If having a TSH greater than 2 increases your risk of miscarriage, then I want everybody of childbearing age, regardless of if they want kids or not, to be less than 2 to feel optimal. In addition, Synthroid is not the only option. to treat a thyroid-related concern or hypothyroidism. There are other types of medications. Synthroid is typically, or just the T4. There are some other medications that are T3 or combination of T4 and T3. Every single individual is going to respond differently. So if you've been put on a medication and you still don't feel well, you might want to look at getting the comprehensive testing done, perhaps having the conversation if there's a different medication type for you. In addition, if you are just addressing the hormone piece and you have an autoimmune thyroid condition like Hashimoto's, where your thyroid antibodies are elevated, if you just give a medication or you're just giving the hormones, you are missing the opportunity to work on the immune system piece. Most hypothyroidism or low thyroid function is due to Hashimoto's, which is an autoimmune thyroid condition. The antibodies are elevated, meaning the immune system is mounting an attack on the thyroid. We mentioned this before, 20% of your thyroid hormone conversion takes place in the gut. Free T3 is the active thyroid hormone. That's very important. So maybe you have fine normal levels of T4, but if it's not being converted to T3, you can still be symptomatic. T3 is responsible for your energy, your metabolism, your body heat, and much more. T4 is converted to T3. We talked about it being converted in the livers, the kidneys, the gut, and 20% occurs in the gut. So that's what we're talking about today, because if we can improve the conversion rate and we can get more free T3 for individuals with low thyroid function, often individuals will feel much better. So it is important to look at your labs. It is important to assess the gut microbiome and look at ways that we can improve this so that your symptoms can be better managed. I really like this diagram because I think it's a really good depiction of all the different things that impact thyroid health. T4, we talked about the conversion. We need things like selenium and zinc to help with that conversion. In addition, to make T4, you need things like iron, iodine, tyranny, zinc, selenium. You can get a lot of these nutrients from a healthy whole food nutrition plan. If you're low in vitamin D, I would suggest that you get on an appropriate dose of vitamin D to correct that. You can get great amounts of selenium and zinc from Brazil nuts and pumpkin seeds. If you have a thyroid-related concern, perhaps considering trying to incorporate some of those things like the pumpkin seeds and the Brazil nuts into your everyday. Factors that influence the conversion of T4 to reverse T3, your inactive thyroid hormone, the one we're highlighting tonight is infection. So we're going to be talking about gut infections that can create chronic stress, chronic inflammation, and make your thyroid not work its best. You also want to have a look at stress, trauma, low-calorie diets. It's really important to address the body from a holistic standpoint. Here are the infection types that we're going to talk about tonight, the ones that are directly related to autoimmune thyroid-related concerns. We're going to talk about how you test for them. We're going to talk about the stool test that I use in my practice, as well as different signs and symptoms and what the literature has to say with these ones. H. pylori, Blastocystis hominis, SIBO or small intestinal bacterial overgrowth, Yersinia enterolytica, and then we're going to talk about two other things that are not gut infections, but they can impact your body's ability to have an optimal thyroid hormone status. So low stomach acid and zonulin, which is a marker of leaky gut. So let's talk about how gut infections increase the risk of autoimmune thyroid-related concerns. We do know that individuals have a genetic predisposition to have an autoimmune condition. So maybe if you've been diagnosed with Hashimoto's or Graves or any other type of autoimmune condition, you can think back in your family tree, in your family history, to see who else has an autoimmune condition. Where did this come from? Now, genetics are genetics. That's what you've inherited from your mom and your dad. But we do know that environment dictates whether or not those genes are expressed. So not every individual with an autoimmune tendency or the genetics to have an autoimmune condition develops one. One of the things we know and we hypothesize is perhaps certain bacteria can turn on that disease process. They can influence the genetic testing, the genes are switched on, and then we start to see an autoimmune condition. Now, many of these bacteria, parasites, different gut infections carry proteins on their outer surface. And over evolution, bacteria, parasites, viruses they want to evade the immune system. They want to hide because the host or the human is providing an environment for them to live and grow and replicate. So what they do in order to hide from the immune system is they disguise themselves. So the proteins on their outer surface, they try to make those proteins look very similar to the proteins that might be on your thyroid gland. So that the immune system, when they have a look, it says, nope, that's fine, that should stay, don't worry about it. The problem is our immune system is really smart. So the immune system can detect that what the bacteria and parasite or virus is doing is trying to hide themselves. And the immune system catches on because it's smart and starts to mount an attack. And what our immune system does is it learns and remembers that protein sequence. So it has this memory. So if it ever encounters the bacteria, parasite, or virus again, it has the ammunition to fight it off faster. The problem is the protein structure on the gut infection, whether it's a bacteria, a virus, or a parasite, that protein structure is very similar to what it looks like on the outer surface of the thyroid gland, or perhaps the TSH receptor, or the TPO antibody. That's what we're measuring on the blood test. Now, this same molecular mimicry theory applies to all other autoimmune conditions too. There is some evidence to support Klebsiella, a bacterial infection. The proteins on its outer surface appear very similar to collagen that is found in the joints. And we see Klebsiella associated with rheumatoid arthritis, an autoimmune condition that impacts the joints. Does that make sense, this concept of molecular mimicry? Can you post in the comments if you need some additional clarification? It's essentially that the immune system is misinterpreting the bacteria or the parasite or the virus, and as a byproduct, the thyroid's being attacked as well. Now, H. pylori. H. pylori is a bacterium that lives in the stomach. It can cause signs and symptoms like nausea, heartburn. Heartburn can also present differently for each individual. So some can see acid reflux, some can see burning in the chest, but for others, it could just be a chronic cough or a tickle in their throat or constantly clearing their throat that we see with H. pylori. You can also see bleeding gums, bruising, a bad taste in your mouth. H. pylori changes the acidity of the stomach. So it becomes much more challenging for you to absorb the nutrients that your body needs. So we see nutrient deficiencies. I often see vitamin D deficiency, B12 deficiency. H. pylori infections can also present as stomach pain, fullness after eating, or feeling uncomfortable after eating, burping, chronic hives with no known explanation. There are studies on infertility and an H. pylori infection, and the nutrient deficiency was already mentioned. Autoimmune thyroid diseases, of course, are multifactorial. So you need that genetic predisposition, but we also need that environmental trigger. Research has shown that there is an association between an H. pylori infection and Hashimoto's thyroiditis. H. pylori infections could be an environmental risk factor that initiates the disease process on the thyroid gland, which is really interesting. So if you have these digestive symptoms, I would recommend getting tested for H. pylori, as well as if you're having some of the thyroid symptoms. In this particular study, they found a relationship between H. pylori and what we call idiopathic chronic urticaria, which just means you have chronic hives and we really don't know why. In this particular study, 36% of patients with unknown chronic hives were infected with H. pylori, while only 23% of the controls were infected. So we definitely see a significant difference. In addition, through eradication therapy, so getting rid of the H. pylori, we found that individuals saw a significant improvement in their symptoms. So when the H. pylori was treated, a bacteria in your stomach, we saw 91.6% of patients, their chronic hives improved. So what I'm trying to do here is just to draw an association and try to bring awareness to how important the digestive system is, how important your normal bacteria is, how important gut infections are, because something seemingly so unrelated, right? What does the skin have to do with your digestive health? What does hives have to do with the digestive health? But if we can really look at the body as a whole and draw these associations, it can really help improve the symptoms of patients. H. pylori and infertility. Here is another one. So we know individuals with Hashimoto's, when it's not treated properly, are at an increased risk of miscarriage. So for anybody who's looking to get pregnant, going through a fertility journey, it's really important to have your thyroid tested. And it may also be useful for you to have an H. pylori test done. We found that patients who were seropositive for H. pylori, which just means their blood work came back positive for H. pylori, were at a significantly higher rate of infertility, especially in patients with undetermined infertility. We just don't know why. So if this is resonating with you, or you've been diagnosed with unexplained infertility, it might be worthwhile to have an H. pylori test done, as well as a full thyroid panel done. In addition, this is really interesting to me. We found women who were positive for H. pylori had an increased risk of premature miscarriage, so miscarriage early on in the pregnancy, as well as infertile males infected with H. pylori showed lower sperm quality compared to unaffected individuals. So if we're dealing with an infertility case where the male sperm count and quality is not as optimal, it might be worthwhile checking into H. pylori. There also is an association between an H. pylori infection and the presence of anti-sperm antibodies, which is really fascinating. So in some patients, what happens is the woman's immune system actually produces antibodies to sperm. And if you are looking to get pregnant, that's not a really great case scenario. And the fact that the presence of a gut infection or a stomach infection like H. pylori can increase the risk of anti-sperm antibodies is quite fascinating. The next conclusion, or the next association I want to draw your attention to, is the connection between H. pylori and anxiety. There is a really big connection between anxiety, depression, and these gut infections. So if you recently, all of a sudden you have heartburn and digestive complaints and bloating and you feel unwell, and you have anxiety out of the blue, or perhaps, you've had major digestive changes and anxiety out of the blue, it would be worthwhile to have a look into getting tested for H. pylori. Individuals who had H. pylori were at an increased risk of psychiatric disorders, anxiety and depression, both of them. And then what this research study did is they looked at, okay, what would happen when we treated the H. pylori? They did see significant improvements in symptoms of depression after the H. pylori infection was treated and cleared. So when we're looking at patients who have acid reflux, pain in their midcage, gastritis, it's not only important to resolve their physical symptoms, but it's also really important to ask about mental health as well, because we know they are absolutely connected. The next one that I want to focus on is a single-celled protozoan. It's more of a parasite than a bacteria, called Blastocystis hominis. We know patients who have an autoimmune thyroid condition are more likely to also have this type of parasitic infection. Now, when we look at how we classify parasites, we have some parasites that everybody agrees produces significant signs and symptoms, and we need to treat them. So major parasite infections like Giardia, no one's arguing that that probably needs to be treated. Parasites like Blastocystis hominis, these are ones that we don't know as much about. For many individuals, Blastocystis hominis is transient. It comes and goes. It doesn't produce any issues. It's relatively harmless, but we can't define every single person as fitting into that box. I definitely have patients who have Blastocystis hominis infections, and when we treat them, they feel much better. I've also seen individuals with mild infections where they don't have any of the signs and symptoms. Signs and symptoms that you might experience from this type of parasitic infection include bloating, diarrhea, nausea, gas, variable bowel habits, so a mix between diarrhea and constipation, kind of like an IBS type picture, abdominal pain, hives again with Blastocystis hominis, as well as carbohydrate intolerance and fatigue. many of the patients with Blastocystis hominis will have multiple food sensitivities. It won't make any sense. They could tolerate foods before, but now all of a sudden they can't have gluten, they can't have dairy, garlic, high fiber foods seem to bother them. Their skin is swelling up, and there's no rhyme or reason for it. It just seems like there's way too many food sensitivities all at once. Now, you can try an elimination diet. You can try to remove gluten, dairy, soy, sugars, starches, caffeine, grains, fruit, carbonated beverages, but that's not the ultimate goal. Will your symptoms improve? Perhaps. Will taking something to lower histamine help? Probably. But the idea is we want to do testing, we want to identify if this is here and then treat it accordingly so you don't have to feel that your nutrition plan is so restricted. In terms of the connection between Blastocystis hominis and Hashimoto's, what we find is the presence of this bacteria increases a cytokine which creates a lot of inflammation called IL-6. So for patients with an autoimmune condition, we see a lot of inflammation. And if I'm seeing a lot of inflammation and digestive symptoms, I want to test and see if Blastocystis hominis is there. So we definitely see a higher amount of inflammation, higher amounts of these pro-inflammatory cytokines. And the problem is, so what does this have to do with how you feel? The problem is if you have higher levels of IL-17, that pro-inflammatory cytokine, that is correlated with the free T3. So if you have Blastocystis hominis and you have the higher pro-inflammatory cytokine, IL-17, we see less free T3. If you don't have as much free T3, you're going to feel really tired, issues with weight management, brain fog, low energy, etc. The best part is treatment of the Blastocystis hominis infection improved the IL-17 levels. Thyroid antibodies were reduced. So now your immune system's not attacking your thyroid gland as much. And the TSH improved as well. So I found this particular study quite fascinating, a simple treatment of a parasite that is technically, if we use air quotes, we're defining this as technically harmless, but it's not harmless for everybody. We definitely see that it can impact individuals with autoimmune thyroid disease. The next one is SIBO, or small intestinal bacterial overgrowth. And if your symptoms are matching every single one that we're going through, that's okay. The best place is to do the testing. The testing that I'll share that I run in my practice at the end, it does test for all of these at once. So you don't have to guess and try to figure out on your own which one is impacting you. So SIBO, or small intestinal bacterial overgrowth, can cause symptoms like acid reflux, belching, bloating, tons and tons of gas, worse bloating after meals. Many individuals have very significant stomach distension, and they often describe it as, I woke up with a flat stomach and now I look pregnant. And the reason this is occurring is because you're having overgrowth of bacteria, and that bacteria is fermenting the foods that you eat and producing a lot of gas. Now, another classic sign of small intestinal bacterial overgrowth is patients will say, if I eat something healthy, like kale, garlic, onion, something, that should be good for me, I feel worse than if I were to eat French fries. This is a classic telltale sign because the bacteria really like those fermentable fibers. The problem with small intestinal bacterial overgrowth, yes, we see an association with the thyroid condition, of course, but this can also lead to depletion of vitamins like B12 and iron, which is key for energy, key for your mental health. It's also key for your nerves to work and headaches and migraines. We also see issues with digestive enzymes with SIBO. So if you have a bacterial overgrowth, we see patients have a harder time digesting things like dairy and starches. SIBO can also be a factor for individuals who say, fermented foods cause me problems, fibrous-based foods cause me problems, histamine foods cause me problems. Those cruciferous vegetables, I love cruciferous vegetables. I think they're incredibly healthy for individuals. They have tons of health benefits, but cruciferous vegetables, probiotics often make patients with SIBO worse. So the idea is we want to test for this and treat it so that these symptoms can go away. What are some of the causes of small intestinal bacterial overgrowth? So what causes bacteria to start to overgrow in levels where they're becoming a problem? Small amounts of bacteria, certain ones, that's perfect. But what leads the opportunity for them to overgrow? If you have low stomach acid, that can give an opportunity for these types of bacteria to grow. Antibiotics can disrupt the normal gut flora. Hormone-based birth control can. Acid-reducing medications can give an opportunity for more bacteria to grow. Food poisoning, constipation can be another driving factor. So in patients with hypothyroidism, when it's not treated, and that's slowing down the transit time, causing constipation, that in itself can create a SIBO-based picture because it slows down the motility. So it does go hand in hand, and we have to look at both together. So what does the research have to say with respect to SIBO and Hashimoto's? SIBO may be present in more than half of patients with hypothyroidism. So if you have been diagnosed with hypothyroidism and you have any of the symptoms that were described, it might be worthwhile having this tested. And we found that significant higher numbers of patients with hypothyroidism have SIBO compared to the control. So SIBO is common in patients with low thyroid function. And if you have chronic digestive symptoms, you should be tested and evaluated perhaps for SIBO or small intestinal bacterial overgrowth. We also know that greater than 70% of patients who have been diagnosed with IBS actually have small intestinal bacterial overgrowth. So it used to be when we diagnosed IBS, we would diagnose it based off of exclusion. So we would exclude out Crohn's and colitis, and once we found nothing anatomically wrong, we would say, okay, this is IBS. Manage your nutrition, manage your stress. Those things are still important, but now we know better, and we know that there is vastly key differences between the gut bacteria in individuals who have IBS versus individuals that do not. And we have abilities to alter and change the gut microbiome. The next one I want to talk about is Yersinia enterolytica. Yersinia is one that we see more associated with Graves and hyperthyroidism. Graves is often not discussed enough, so this is one that I wanted to put in as well. Yersinia you can find from the ingestion of undercooked foods, undercooked pork, meat, dairy, and water. And Yersinia closely resembles, again, that protein on the TSH receptor. Also closely resembles other types of thyroid proteins like thyroglobulin and thyroid peroxidase. So this is very, very similar and supports our theory of molecular mimicry. This particular study was a meta-analysis. And what a meta-analysis is it takes all of the research that has currently been done and does a big review on it. So they looked at 8 studies with a total of 1,490 participants, and they found a significant association between Yersinia enterolytica and autoimmune thyroid disease. This significantly increased the risk of Graves. So if an individual who's listening on here was diagnosed with Graves' disease or hyperthyroidism, if you can think back, did you have a gut infection? Did you think you had food poisoning? Did you think you had a stomach bug? Were you feeling unwell digestively prior to finally being diagnosed with your thyroid conditions? So further study is definitely needed, but for anybody who has the development of a thyroid condition, this is something that I'm looking out for. And remember, the thyroid antibodies that suggest an autoimmune condition are elevated up to 10 years prior to the thyroid hormones becoming impacted. So if we can proactively test for an autoimmune thyroid condition, then we have an opportunity to look at the gut health and see what improvements we can make. And perhaps there's no cause and effect studies for this, but my hope is identifying these gut bacteria and treating them appropriately can perhaps prevent the development of a full-blown autoimmune condition. The next topic I want to talk about is low stomach acid and why this is really important. Individuals with hypothyroidism often have low stomach acid, which we call hypochlorhydria, or just low acid production. Hypothyroidism, everything slows down. So the motility in the gut slows down and we see constipation. The acid secretion in the stomach slows down and we see this lack of stomach acid. The problem with this is stomach acid is needed for B12, needed for iron, and when you're not absorbing these nutrient levels and you have low stomach acid, supplement, yes, it can be helpful. But we really have to assess if you are spending and investing in supplementation and it's not being absorbed to its max ability, is that truly helpful? So one of the things we might want to do is run the GI map stool test. That can give us an idea of stomach acidity and your digestive enzymes and how much you're producing. This can be really helpful in individuals who have fatigue despite taking thyroid medications. If you don't have enough stomach acid, this is a really important first line of defense so that bacteria don't begin to overgrow. You could develop subsequent infections from having low stomach acid like SIBO and parasites, nutrient deficiencies. We can see multiple food sensitivities because your foods are not being digested properly. And one of the highlights I wanted to point out is it's not a typo. Low stomach acid can cause acid reflux. So we always think of high stomach acid causing acid reflux, and we need to give a medication to suppress that. But it's not always the case. Many individuals will have low stomach acid, and when you don't have enough stomach acid, that will not signal to the sphincter or the door at the top of the stomach to close to prevent the acid in the food from coming back up. One of the ways you could test at home with your stomach acid is you could take additional betaine HCl. So here it says on the right, ways to improve stomach acid. The first is betaine HCl. Betaine HCl is essentially you're taking more stomach acid. So technically, if you take betaine HCl with a meal and you have great optimal levels of stomach acid, if you were to take more, you should feel burning, you should have acid reflux. If you take it and you don't feel anything, that could pinpoint that you don't have enough stomach acid. Then at your next meal, you could take 2 and see if you produce the acid and burning. If still not, you can go up to 3. I really would not increase past 3 without the guidance and support of some sort of practitioner, but that could be a way to test. If you have great stomach acid and you add more on, you should feel acid reflux. But if you don't, that may point to low. So you can do the betaine HCl challenge test. That's what it's called. Yep, you can get betaine HCl plus pepsin over the counter. The Designs for Health one is one that I carry and like, and the reason I like it is because it's a higher dose per capsule. So then you don't have to take as many. So 700 milligrams per capsule, that could be one to consider. You can also buy other brands. There are some brands that I know and trust, and I'm really confident in what they're putting in their bottles. I'm just not familiar with all of them, but yes, you can do that. Another great way to improve stomach acid is to have bitter foods before your protein. So the first phase of digestion happens in the mouth. The more you can smell your food, cook your food, like get in the rest and digest phase, the better it's going to be. Bitters before your meal might be something as simple as starting with a leafy green salad with the oil vinegar dressing. That's particularly bitter. Some individuals like apple cider vinegar diluted in water as something bitter to improve their digestive capacity before their meals. Fermented foods, vitamin C, peppermint, chew and digest, rest and digest are all other ones. It is very, very important to chew your foods and sit down and be in a relaxed state, not distracted. I think that's the one thing that is so important that we often forget. Try not to eat while you're doing other things, while you're on the go, eat standing up. Just sit down, prioritize having rest and digest time. Low stomach acid and iron deficiency and why this is so important. I don't think iron deficiency is taken seriously enough. Iron is required to make thyroid hormones. Iron is also important for converting the amino acid tyrosine into dopamine, and that's your motivation hormone. Iron allows you to carry oxygen around your body. If you're not carrying oxygen around, you will have fatigue, brain fog, low motivation, slowed metabolism. Now, iron does impact your weight, and the way it does this is by influencing how your body handles your blood sugar. We know from research that individuals who have low iron do not tolerate their blood sugar as well, and they have an increased risk of insulin resistance and type 2 diabetes. Insulin resistance can cause weight gain, especially weight gain around the midsection. And if you have impaired sugar metabolism or you can't manage your blood sugar efficiently, you're going to have ups and downs in your blood sugar and not feel as great with carbohydrates. In addition, the same thing with the thyroid gland, optimal versus quote unquote normal levels of iron are much different. So if we're looking at a ferritin level, ferritin tells us your amount of stored iron. I would say at the very least you want that to be 50. And some of the reference ranges are even going down to 5. There is a blood work presentation that I've done as well. If you're wanting to know exact kind of optimal normal levels, you can check out that presentation too. I go in more into detail with the iron. And the last one that I want to talk about is zonulin. Zonulin is a marker of leaky gut or intestinal hyperpermeability. The way I think of the intestinal cells is like a strainer. You want a really small holed strainer. You want those holes very, very small, or you want the intestinal cells really tight together. We call these tight junctions. We want them tight because right behind the intestinal cells is our immune system. And we don't want undigested foods and bacteria to get through the intestinal lining and start to trigger the immune system unnecessarily. In leaky gut, what we see is those spaces start to become bigger. For some individuals who have gluten sensitivity or celiac, we can see the zonulin levels increasing or the marker of leaky gut increasing. We also know over-exercising and chronic stress can cause this leaky gut pattern that we're seeing. So if the zonulin's high, we really do need to address that for anybody who has an autoimmune condition because your immune system's already on edge. It's already overreactive. So what we need to do is tighten up those spaces so we're not tempting or provoking the immune system unnecessarily. Potential causes of leaky gut: alcohol, caffeine, gluten, dairy, processed food, sugar. Not everybody has to be gluten-free and dairy-free, but if you're not feeling well with those foods or you know you have leaky gut, it would be wise to potentially remove those foods for a period of time and see if you get better. Harsh household chemicals, environmental toxins. Try to just be simple and clean when it comes to your cleaning products. When it comes to your skincare, simple is always a better way to go. Try not to be drinking a ton of contaminated water. Filtered water is great. Manage your mental health. Make sure that you're not over-exercising. All of these lifestyle keys are important too. I have created a product called Gut Revive that is specifically for leaky gut. It has L-glutamine in it, which is very nutritive for the intestinal cells, aloe vera, zinc carnosine. Some of these ingredients too can be helpful for thyroid antibodies like the aloe vera. Zinc carnosine is great for leaky gut. Slippery elm and marshmallow, these are nice and soothing for the digestive tract. Now, a lot of these herbs, keep in mind, are in higher therapeutic dosages. So when we do that, there is a stronger therapeutic effect, but it is harder to mask the flavor. So one of the things with the Gut Revive, it says natural chai. I like to mix it in with smoothies because the taste on its own, personally to me, I don't prefer it. And I never shy away from sharing this. This is not a delicious pink drink like the Relax and Focus, but it truly does work because there is therapeutic levels in it. Doesn't contain gluten, wheat, soy, dairy, true fats, peanuts, all of that, of course. But if you're suspecting that you have some leaky gut, intestinal hyperpermeability, gas, bloating, this could be something to consider trying. Now, if you have H. pylori, if you have small intestinal bacterial overgrowth, if you have Blastocystis hominis, this is not going to fix those conditions. If you have an infection that needs to be treated, we need to treat it. How to test. So the way I pick up these gut infections is with a DNA-based stool test called the GI map test. It looks for everything that we talked about in today's presentation. It also looks for candida, viruses, like Epstein-Barr virus, which we didn't cover tonight. It also looks at your normal gut flora. There are certain bacteria that are really important for healthy weight management. It has a look at that. If you don't have enough acromantia, for instance, it's much more challenging to maintain your weight. So all of those markers are looked at in the GI map test. It has a look at calprotectin, which can help rule in or rule out Crohn's or colitis or irritable bowel disease. It measures digestive capacity, leaky gut. What else? A marker of your immune function, and it can suggest gluten sensitivity. This doesn't test for celiac. The gold standard is a colonoscopy endoscopy, but we can definitely get an idea of gluten sensitivity on this lab. Here's what the test looks like for what we chatted about. So it looks at the H. pylori. I also really like that it tests for these virulence factors. So what does that mean? So virulence factors tell us how likely is the particular bacteria that you have, the particular strain of H. pylori that you have, how likely is it to cause stomach ulcers? How likely is it to be a chronic infection? How likely is it to cause stomach cancer or duodenal cancers? Because if these ones are positive, we're going to be definitely more aggressive in our approach in clearing that. Opportunistic bacteria, these are the bacteria that given the right opportunity, they can overgrow. We talked about these in terms of small intestinal bacterial overgrowth. Keep in mind the GI map test is measuring the bacteria in the large intestine. It's not a direct measure of the small intestine. Perhaps if you know about SIBO, you might have heard of a breath test being done. You definitely can do a breath test to confirm. The GI map, I find, shows so many other things that I like to use this first, and I'm making, and like I'm inferring SIBO would be there. So if I'm seeing overgrowth of the strains that we see in SIBO in the large intestine, I'm inferring that they've moved up to the small intestine, because I always get questions with that. Also looks at the potential autoimmune triggers. So these are the bacteria that we know can potentially trigger an autoimmune disease in the genetically susceptible individual. So these are the ones I'm always keeping an eye out for. And this is a really great chart too. So not only for individuals with an autoimmune thyroid condition, but perhaps if you also have rheumatoid arthritis or type 1 diabetes or psoriasis, these are the bacteria and the associations that we know we have. I've added Yersinia in there. I don't know why it was missed, but Epstein-Barr virus, EBV, is another one that we often see in patients with thyroid disorders. So think back, if you have an autoimmune thyroid condition, did you ever have mono, right? So EBV is mono, essentially. General considerations. In general, if you have an autoimmune thyroid condition or suspect that you have one, I would recommend you test and treat for gut infections to see if anything are there. We know nutrients that are important for the thyroid gland include B12, selenium, those Brazil nuts, vitamin D is really important for your immune system, and acetylcysteine can be helpful for patients with elevated thyroid antibodies, inositol as well, if you have inflammation, curcumin, zinc. Many of those ingredients are found in the Gut Revive product. Now, a gluten-free diet for a period of time, 6 to 8 weeks, or an autoimmune paleo diet, if you have an autoimmune condition, I would recommend trying that out. It is restrictive in the sense that you're removing a lot of the inflammatory foods, but the idea is do an autoimmune paleo diet for 2 months. Just Google that, AIP Nutrition, or go on Pinterest. There's tons of free meal plans. Do that for 1 to 2 months. Then slowly reintroduce the foods every 3 days that you've removed to see which ones cause you symptoms. So if you're feeling really great, and then all of a sudden you add back in gluten and you have a headache, or your energy's low, or you're not sleeping as well, or you have digestive complaints, that might at least give you the information to say, okay, maybe it's not worth I have gluten all the time. Amino acids are really important because they help to build the thyroid function. So I use a scoop of the amino lean every single day to ensure that I'm not only building lean muscle mass, but I'm also supporting building my thyroid hormones. Amino acids come from protein, I find individuals are very deficient in protein. It's hard for them to get enough in. Food is always first. So if you can eat an abundance of protein and ensure you have a palm-sized portion of protein at every single meal, I would do that first. But if not, you could consider amino acids. We talked about the betaine HCl to improve stomach acid and digestive capacity. You do not want to take betaine HCl if you have gastritis or a stomach ulcer. If you add more acid onto an ulcer, you are not going to enjoy the experience. So it is important, as much as I'm talking about supplements, to always speak to somebody before adding them in. If you have cortisol and inflammatory issues, stress and inflammation, you might consider adding something like a fish oil or a curcumin. And if stress is really bad, you might want to consider something like ashwagandha. I really like ashwagandha. It's been shown to have improvements in the TSH, T3, and T4. Now, you have to watch with it though. So ashwagandha can increase your thyroid levels. This is fantastic for somebody with low levels. But if your levels are at the upper range, this can cause some anxiety. So the ashwagandha is in the cortisol reducer product that's on my website. I really like ashwagandha in general. If you want to learn more about the studies on ashwagandha, all of the products on my website, I have made tech sheets. So you just click on the tech sheet and it'll show you the exact ingredient that you're looking for and what the research has to say. Here's the leaky gut bundle and the insulin resistance bundle. I've thrown the insulin resistance one in here because so many individuals come to these presentations with insulin resistance, and I'll actually tell you about the presentation in 2 weeks on that in a second. But if you have digestive complaints and you can't get testing done, these are the ones that perhaps you can consider: a probiotic, digestive healing, and digestive enzymes. I didn't put on here an antimicrobial because it's very hard to know what antimicrobial to use for each specific infection. So if you have H. pylori, what we would use to treat that is going to be different than what we would use to treat Blastocystis hominis. Berberine is a product that's antimicrobial. It can kill off bacteria, but the best is to always work with somebody who can guide you through diagnosing and treating to make sure that you're not taking something that's going to be harmful. If you have SIBO or too much bacteria and you take additional bacteria, you're probably not going to feel so great. How to test. So this is what I would test for. I would run the GI map stool test. I would do a comprehensive thyroid panel. I would test the vitamin D, the iron, the inflammation, and cortisol, because these all play a role in impacting how well the thyroid gland works. Okay, so if you wanted to run this blood test on your own, you definitely can. If you are in the US, there are many private lab companies you can just order this from. If you want to work with me in my practice and have a look at your thyroid health, have a look at your past labs, or have a conversation about your health history and figure out exactly what we need to order for you and what your treatment might look like, I am accepting new patients. My information's there for my office. Allison, my patient care coordinator, is fantastic. We can help get all these tests sent to you as well as we ship out the stool kits. And now, before we start the Q&A, I will go through the chat box and answer any of the questions that came in. But I did want to mention that July 14th, we're going to be doing another presentation more about the impacts of insulin resistance on weight loss. So this is the top thing that I treat in my practice. I deal with a lot with resistant weight loss and getting to the root cause, whether that's thyroid or insulin resistance or cortisol. So this webinar in July, you're welcome to sign up for. You are also going to be receiving an email at the end of this presentation with the link to this presentation, so you don't have to worry about writing that down. You are also going to be receiving a discount code if there's any of those products that you want to try. Discount code for coming onto the webinar. Thank you for joining. And now let's see if I can get to your questions here. If you have questions that are unrelated to thyroid while we're on, I'm happy to answer those as well. We talked about the specific test for low stomach acid. So there's one of two ways, right? So you can run the GI map test to get a general sense of what's going on with the digestive capacity, or you can take yourself through that betaine HCl challenge. There's many PDFs online as well. If you just Google betaine HCl challenge, it'll walk you through how to do it. You know, you take 1 capsule with the meal, see how you do. Then the next meal, try 2 with the meal, see how you do. As soon as you feel that burning sensation, so say you feel a little bit of discomfort, a little bit of acid reflux, a little bit of burping with 2 betaine HCl capsules, then you would actually drop it down to 1. And then eventually with taking 1 at each meal, what we find is you'll start to experience that same sensation with 1, and then you would take your dose to 0 capsules. There will be a recording as well. The recording will be in that same email that I'll send out 24 hours after this. Is it okay to take tummy tone with Barrett's esophagus? So I would always recommend checking with your doctor, of course. If you have a concern with swallowing pills, then you might want to open the capsule, but there's no direct interaction with tummy tone and Barrett's esophagus. You definitely can take them together. How much is the thyroid test? So it depends on where you are, whether you're in US and Canada or Canada, depends on what province you are in Canada. So in the US, I use a wholesale lab company, so you pay the lab directly. And because I'm not in the center of it and I'm not compensated for those labs, the prices are much better. So a full thyroid panel would be roughly $50. And what happens is the lab will send you a link. I write down exactly what tests I want to be ordered for you. You pay on that link, and then you'll get a requisition. Once you have the requisition, you'll just simply enter in your zip code, and it'll show you what labs are in your area. Some areas have phlebotomists that will come directly to your home, and we get the results within 2 to 3 days. My practice, I am currently virtual, and I practice all around. In terms of the US, it's very easy to run blood work. There are some states that are exempt, like New York, New Jersey, and Rhode Island. Ontario, Canada is great for me to run blood work. Saskatchewan's great for me to run blood work. BC is great for me to run blood work. Some of the other provinces, we ship you kits in order to do it. And the pricing does change based off of where you are. If you have questions or concerns, you can contact my office and we can try to help give you an estimate. This is a really great question. Can it be the opposite? So what is the association between small intestinal bacterial overgrowth and hypothyroidism? There's definitely a bi-directional relationship. So did the SIBO trigger Hashimoto's? There is some evidence to support that through molecular mimicry. We also know that SIBO can develop because of hypothyroidism. So we'll never know which one came first. And the reason small intestinal bacterial overgrowth can occur in individuals with hypothyroidism is because everything slows down with hypothyroidism. So if we're slowing down motility and we're slowing down how fast stool is moved through the digestive tract, that can give an opportunity for bacteria to grow because they're just hanging around longer. Did I miss the price timing for the GI map test? Again, it depends on where you are from. So roughly the GI map test would be around 500 to 570 Canadian, which is about 35% less American. So you'd have to do the conversion on that. And I know it's really confusing because I talk both in Canadian dollars and US dollars. When I mentioned the quote for the thyroid comprehensive test, that's 50 US. So you're looking at roughly 350 US for the GI map test, more or less depending on the exchange rate. Do you still have Hashimoto's if your thyroid is removed? So technically, if you don't have a thyroid, there would be nothing for your immune system to mount antibodies against. So technically no, but you still have that genetic predisposition to autoimmunity in general. So what you might want to have a look at is once you have one autoimmune condition, we know that there's a slightly increased risk of developing a subsequent one. So keeping an eye on an ANA or having a look at your digestive bacteria, or really just paying a close eye on your symptoms to make sure no other autoimmune conditions develop would be great. Ontario, a full comprehensive blood panel, everything from hormones to thyroid to cholesterol to liver, kidneys, the full everything is roughly, let's call it 200, 170, and that would include your visit too. We have different ways that we run blood work depending on the province that you're located in. On the GI map test, what does it mean if the Bacteroides are high but Firmicutes are normal? So what it's really important to have a look at with the Bacteroides Firmicutes ratio is to look at the actual ratio. Now, when we classify bacteria into groups, right? So Bacteroides is just a group of bacteria that look a certain way. Firmicutes is just a group of bacteria that look a certain way. So the same way we would classify animals as, you know, this animal is either a dog or this animal is a cat, and then there's different species within each one. That's what we're doing with the bacteria. Now we look at the FB ratio because when the Firmicutes Bacteroides ratio is high, we see increased inflammation, increased caloric extraction from the foods that individuals eat, increased risk of insulin resistance, and increased risk of obesity. So if you have a high FB ratio, you are more likely to be obese or have resistant weight loss or have an issue with managing your weight. And the last thing you want to do in that case is add on a lactobacillus probiotic, because that will raise the Firmicutes more. That's why the tummy tone is all bifido-based, because it falls into the Firmicutes category, which for this particular individual that responded might not be the best option. A lot of the bacteria that are associated with SIBO, so staph, strep, bacillus, those types of bacteria fall into the Bacteroides category. So if you also have a lot of the opportunistic bacteria high, treating that will improve the ratio. You definitely are able to book appointments with me. So if you're on my website and you're trying to book an appointment and it's only listing the coaches, Allison, Lisa, Catherine, if it's only listing that, then you're on the wrong page. So that's for the Metabolic Reset Program. If you want an appointment with me, you have to contact Allison directly at my office. So that there should be a contact page, or it's info@wildsidewellness.com. I'll include the phone number as well. Everything, how about I include that in the email after? If you want to get in with contact with Allison at my office, you definitely can. So I hope that was helpful for you. I managed to stay within an hour for the first time ever on a presentation. The insulin resistance presentation will fill up rather quickly because this is a more popular topic that I talk about. I would love to see each and every one of you there. If you have any additional questions, the email that you send out or the email that I send out 24 hours from now, just respond back to that. I'll be reviewing them. I'm happy to help. And if you're interested in booking a one-on-one with me, my office is available there. Allison's available. I'll send all that contact information over as well. So I hope that was helpful. I hope it helped gain some insight in terms of how the gut bacteria can impact other things, not only autoimmune thyroid, but also anxiety, hives, infections. So I found that quite fascinating. I hope you did too. And I hope you have a wonderful evening. Bye now.